Hi, my name is LaQuasha Gaddis, and I'm currently a student at Walden University working on my doctorate degree in public health. I also work as a public health analyst for the Centers for Disease Control and Prevention and have worked as a chemist in the smoke analysis laboratory studying tobacco-related products as well as exposure to secondhand smoke. My purpose in coming before you today is to talk about protecting the health of children under 18 by reducing their exposure to secondhand smoke in cars. Hence, smoke-free vehicle laws need to be implemented in every U.S. state. Secondhand smoke exposure is a significant public health burden not just to non-smokers, but to children under 18 as well. According to the CDC, cigarette smoking is the leading preventable cause of morbidity and mortality in the United States. The 2006 U.S. Surgeon General report concluded that there is no safe level of secondhand smoke exposure, and children remain more heavily exposed than adults. Thus, children are a vulnerable population who may not understand the health risk of secondhand smoke exposure, nor do they have ways of protecting themselves. The home and cars are the primary sources of exposure for children. The adverse health effects of children being exposed to secondhand smoke include sudden infant death syndrome, ear and respiratory infections, as well as asthma and pneumonia. The Global Advisors on Smoke-Free Policy stated that an estimated 60% of U.S. children aged 3 through 11 years are exposed to secondhand smoke, and about 25% live with at least one smoker. Moreover, each year, 150,000 to 300,000 children under 18 months of age contract lower respiratory tract infections caused by exposure to secondhand smoke, as published in the December 2008 Health Policy and Ethics Journal. Children who are exposed to secondhand smoke in cars may have increased medical and health care costs, which are paid for by the government. A review published December 2008 in Health Policy and Ethics Journal found that the direct medical cost of secondhand smoke exposure among U.S. children totaled about $5 billion per year. Economically, smoke-free policies are low cost and easily implemented. Smoke-free policies have been enacted in 30 states within the U.S. These laws require public places such as restaurants, bars, and workplaces to be 100% smoke-free. According to the American Non-Smokers' Rights Foundation, smoke-free laws protect about 49% of the U.S. population. The vast majority of scientific research has shown that smoke-free laws are effective in reducing secondhand smoke exposure. Since 2006, 7 states have implemented smoke-free vehicle laws for children under 18 years. While some parents or adults who smoke in the presence of children may argue that their rights are being violated by smoke-free vehicle laws or that they're being discriminated against, a supportive approach has to be taken to make them aware of the health benefits in quitting. Ethically, the government has an obligation and responsibility to ensure that children are in safe and healthful environments. Smoke-free vehicle laws would also be ethically similar to seatbelt, car seat, and helmet laws, which are all used in an effort to protect the health and well-being of children under 18. In short, support for smoke-free vehicle laws has been shown favorable by both smokers and non-smokers when it comes to protecting the health of children. Continued partnership with the CDC, the FDA, American Non-Smokers' Rights Foundation, as well as other local, state, and federal organizations are needed to increase advocacy in reducing secondhand smoke exposure. The main goal for banning smoking in vehicles is to protect non-smoking passengers from exposure to secondhand smoke and improve health outcomes. Therefore, legislation that regulates smoking in motor vehicles when passengers, especially children, are present, are necessary. Thank you.